morning.
Good morning. Hey, come here. All right, if you would be willing to turn on your cameras, I would greatly appreciate it. So today's the last day of class, and I will have your third exam set up and your final and your fifth lab quest in tonight. I'll have them open for you. You will have until May 9th to get them done. There won't be another case study. I'm just going to give you all points for the third case study. I planned on having 3, but if I had wanted that, I probably should have set it up before the semester started and know what ones we were going to do. So there's only going to be 2, and I'll give you points for the third one. I want you, and I know some people have already done it, I want you to do all of the smart book assignments and all of the chapters, even though we're not going to finish all of the chapters in lecture, because I want you to have the background regardless and have some knowledge. I think we've covered the most important things. And I set it up like that. I set up what I thought was most important at the beginning of the semester. But I still, if you turn all your cameras, I'd still really appreciate it, just so I don't feel like I'm talking to myself with a bunch of names in front of me. Thank you. Are there any questions? Let's jump into today, and we will see if we get more people. I know I got some emails last night about internet issues, and so we'll just see if we get more people. Oh, so your chapter 3, just so you know, it will be over the fluid and electrolytes and chapter 23, not chapter 23, chapter 25, the digestive system. So if we haven't gone over, like I said, I want you to do the smart book assignments. I want you to do the quizzes for all of the chapters that we were going to do this semester. However, the third exam will only cover the fluid and electrolytes and the digestive system. Only the ones are covered in lecture. And your final is comprehensive, and I will have it set up for you tonight. It might not be until midnight, but it will be set up tonight. And so your third exam, your final, and third exam, your final, and your fifth lab quest will be open tonight. Are there any questions?
No. Did you get my email about?
Becky, I got your email. I said I honestly I I looked at it just long enough to see that it was from you and that it had to do with internet issues.
Yeah, it was
And
actually,
it might have been an extension too.
yeah, I was, if you could just, because I didn't get my,
How about, can I just say yes for right now?
that sounds good to me.
Okay, all right.
That works.
I'm just saying yes, and I because I understand.
All right. Yeah, I was able to do one of the Wiley labs at work
Mhm.
yesterday, but
Mhm.
there's still two that need done. And when I got home, I couldn't get in and it was just a nightmare. So
I don't think you were the only one who had issues
Yeah,
getting in
I was
last
having
night.
similar issues as well. So
okay.
Yeah. Um. What was it? You know what? Let me just do this right now, and then we won't have to worry about it. It was was it the Wiley lab exercise for last night? There was
It Bodie,
it
get
was Wiley, like I think it's for reproduction, male and female.
okay. That's the one we're gonna do today.
okay. Mine was the chapter 27 smart book and the chapter 27 quiz.
All right.
When I got home, I couldn't get in with my internet to get that done.
Okay. Let me do this right now though. I'm just gonna open up the Wiley exercise front that was due last night for another 3 days. And that'll fix that hopefully.
Professor, please,
Yeah.
I can find chapter 28 quiz.
The chapter, say it one more time, what quiz?
Chapter 28
28.
quiz. Yeah.
I will, let me figure it out. Give me a second here. Just set it up so it's on the 5th. Start. Okay, so this is set. So, and the connect. Becky, he just needs you to know that he's there.
I know. He wants everybody to know he's there.
122. Eventually. Maybe. So 27 and 28. Okay, so the 28 one is going to open right now. It should be open now. And the 27.
27 is open already.
It was open and it's now closed, but I'm going to open it again. The 28 is still open. Or sorry, it opened this early this morning, and it will be open until next week. And the 27 one is open too. Right now. R. Any other questions for right now? Okay. Let's wow. Let me do something else. So the virtual labs. Why am I doing that? Just a second. Sorry, talking to myself just a little bit. The virtual labs, the last two virtual labs, one about digestive system enzymes and digestion, and one about it's a fetal pig dissection. I'm opening them right now. Okay. Any other questions, concerns?
No, thank you.
All right. So you will see that with the lab tonight, and just to avoid any questions later, I combine the two systems and I combine the exercise. So it's worth 20 points and it covers both the male and female reproductive systems. Somebody has a little dog.
Mm.
No, that's my daughter. I mean, my son acting like a dog this morning. I don't know why.
You know what? We won't say anything.
She's really good though. She had me convinced.
Yeah, that was really funny. Don't tell her that we thought she was a dog.
Oh, it's a he hears y'all.
Okay, he hears. Okay,
It's okay.
he's good for it. All right.
Oh, yes.
That's funny. All right, so actually, before we jump into this, I'm going to back up just a little bit. I thought I was going to back up. Maybe I missed the question. Okay, which of the following represents a complete chemical reaction for the bicarbonate buffer system?
B?
B is in Bravo.
Yes.
You're close, but no.
I was gonna say either. Wait, never mind.
Is it A?
It's A. It's A. So carbon dioxide and water immediately combine to form carbonic acid. And carbonic acid immediately dissociates into bicarbonate and hydrogen ions. The reason we know this is a really good reaction for measuring pH is because pH is measured, bear with me here just for a second. Well, that's not what I meant to do. pH is measured by the negative log of the free hydrogen ion concentration. So the more hydrogen ions there are, the lower the pH, the more acidic it is.
I'm sorry, did you say the more hydrogen ions that there are, the more acidic it will be?
Yes,
Okay, thank you.
because the lower the pH number, the more acidic. I like to think, the way that I think of it a lot of times is think of the fact that the pH value has an inverse relationship with the amount of hydrogen ions around. So if you increase the number of hydrogen ions, the pH number goes down and it's more acidic. The lower the pH number, the more value, the more acidic it is. And it's because of the increased hydrogen ion concentration. So usually when we are looking at how we regulate body pH, we're looking at these two values. What do the lungs, if this is our equation, this is our equation. So the lungs and the urinary system are going to be our major players in being able to regulate pH. The lungs can regulate pH by altering this. And more specifically, let me change this. They don't regulate the water so much as they regulate carbon dioxide levels. This is what they can, how they can influence pH, the lungs. In contrast, the kidneys can regulate this. So lungs can alter the amount of CO2 in the body, carbon dioxide. And the kidneys can regulate the amount of free hydrogen ions in the plasma and the amount of bicarbonate in the plasma. If we reduce the amount of CO2, carbon dioxide, the reaction is going to move to the left. And we're going to reduce the amount of hydrogen ions we have in solution. If we reduce or increase, let's say, let me go with it. If we reduce the amount of bicarbonate and hydrogen ions in the plasma, the reaction is going to shift to the right, because the lower it works by mass action. Whatever product, excuse me, whatever reagent here, whether it's the bicarbonate or the hydrogen ions, whatever if the reactants are higher, if these are higher, they become the reactants. If these are higher, they become the reactants. Is this making sense?
Yes.
And so they can both be the reactants or the products of the reaction. It just depends on which one is higher. Whichever concentration is higher, it's going to become the reactants. It's a law of mass action, whichever one is higher. So if we blow off CO2 in the lungs, this becomes lower and this becomes higher, these becoming the reactants in that case and creating more CO2. And the result, if these become the reactants, is we reduce the amount of free hydrogen ions in solution, because this will become this. If we reduce this bicarbonate and hydrogen ions, CO2 becomes the reactants with water, and this increases. So the only way that we actually measure pH is this. So this is our way of indirectly assessing what is going on with carbon dioxide levels, what's going on with bicarbonate levels. If this is high, we know CO2 levels are high. If bicarbonate is high, we know hydrogen ions levels carbon dioxide levels are high. And that the hydrogen ions are going to equal the number of bicarbonate. Question about this?
I am so sorry, but I would really greatly appreciate it if you can repeat that last thing that you just said. That confused me. I'm sorry.
Let me think. What did I just say?
So
if hydrogen ion levels are high, we know that carbon dioxide is high. If carbon dioxide levels are high, we know that hydrogen ion levels are high. If bicarbonate is high, we know that hydrogen ion levels are probably high also, because they're equal. Does that make sense?
yes.
And the lungs can only affect the carbon dioxide levels. Kidneys can only affect bicarbonate and hydrogen ions. As my mother will say, and she's in another room here, she will say that this is critical for you to understand. So if you're not sure, let me do it again. We'll go through the digestive system today completely. We will finish the fluid and electrolyte. If you need me to go through this again, let me go through it again. Because acid-base balance is really important. So I'm going to shift a little bit here. So proteins can buffer a drop in pH with their what side groups, and can buffer an increase in pH with their what side groups. What were the two side groups found on every amino acid? What were the two pH groups found on every amino acid? So the two, if think about it this way, the name alone, this is the way that I try to work to remember it, or I've learned to remember it this way. Every amino acid, just from the name by itself, because we know these are the monomers for proteins. Every amino acid has an amino group, which looks like NH3. That's not what I meant to do. But NH3 over here, it has an amino group. Oh, you guys, I'm just going to retype it. Bear with me. Every amino acid, just from the name alone, says that it has an amino group. I did it again. Hi. Amino acid, just from the name by itself, has an amino group, functional group, and an acidic group. What is the, when we look at the amino group, functional group, what's one of its major chemical properties? Someone, if you're not sure what it is, Google it and tell me what are the chemical properties of an amino group.
Like
Is it carbon dioxide, like carboxyl since?
You're
No.
right. What? So this one, the acidic group, is going to be a
Oh,
carboxylic acid. But so that's going to be the acid part. And it looks like this. But what are the functions of an amino group? Look up what are the chemical characteristics of an amino group.
All amino acids have a basic structure that consists of carbon, hydrogen, oxygen, and nitrogen atoms.
Okay, tell me, look up what are the chemical characteristics of an amino group, functional group, amino functional group.
Are you looking for like a chemical reaction or
Just
just?
functional characteristics, chemical characteristics.
A nitrogen atom
Yeah,
bonded in 2 hydrogen atoms.
okay. What are its chemical characteristics?
Mm. Why is it not coming up?
Like carboxyl.
Let me help a little bit here.
Okay. I'm like,
Okay, so chemical characteristics. Actually, let me change it. Chemical properties. Let's try that one instead. Chemical properties of an amino group. Maybe that I wasn't asking you to Google the right thing. Chemical properties of an amino group. Not amino acids. It really does like to give you amino acids. Chemical characteristics of an amino function group. An amino group consists of a nitrogen. This is probably what someone found. Sounds like it is. An amino group consists of a nitrogen atom attached by single bonds to hydrogen atoms. An organic compound that contains an amino group is an amine. Like oxygen, nitrogen is also electronegative. Let's see if we can get more information. Okay, this one right down here in Britannica.com. An amino acid, any group of the organic molecules that consists of a basic amino group and an acidic carboxyl group. So what's one of the chemical characteristics of an amino group? When I'm saying chemical characteristics, I'm saying, is it acidic? Is it basic? Is it polar? Is it non-polar? What's one of the characteristics of an amino group?
Acidic.
Oh, no, look at it again. What does it say, Becky? Can you read what my screen says? I know it's really tiny print.
Oh, basic, sorry, amino acid,
Basic. All right. And what about the carboxyl group?
acidic.
Acidic. So when we're looking at this question, a protein can buffer a drop in pH with their blank side groups and can buffer an increase in pH with their what side groups. If there's a drop in pH, what does that mean?
It's more acidic.
More alkaline. Wait, I said
More
If it
what?
raises, it's more alkaline. If it drops, it becomes more acidic.
So it's becoming more acidic. And so what does that mean about the hydrogen ions? In the first part, can buffer a drop in pH with its what side groups? If there's a drop in pH, what's happening to the number of hydrogen ion groups? Excuse me, free hydrogen ions. What's happening to the number of free hydrogen ions if it's becoming more acidic?
they're going up.
They go up.
They're going up. How do you buffer that? How do you help that?
By putting more bicarbonate.
Putting more bicarbonate. What else can we do if we just have an amino acid or a protein that has amino acids?
You add more, is it carboxyl?
No, because which one is the acid and which one is the base?
The base is the amino group, the acid is the carboxylate.
Right. So what one, if we're dealing with an increase in the amount of free hydrogen ions and we need to bring that down, what side group is going to participate in being involved there and being able to bring that down?
The amino group.
Okay, so the amino group, and if there's an increase in the pH, meaning that the solution's becoming more basic, meaning we're getting less hydrogen ions in solution, what are we going to do? What functional group can we use to bring up the amount of free hydrogen ions?
The acid group.
So
Which is-
tell me what the answer is here.
C.
It's C. So the proteins can buffer a drop in pH with their amino groups, amino side groups. Proteins can buffer a drop in pH with their amino side groups and can buffer an increase in the pH with their carboxylic acid or carboxyl side groups. So this is the way that many proteins are going to work as buffers. Also have phosphate buffers that's nearly identical to this bicarbonate system. But the acid is a sodium salt of dihydrogen phosphate, and the base is monohydrogen phosphate. So this would be having a sodium attached to it, this conjugate. Of course, I'm messing that up. No, that's right. This would have a sodium attached to it. Are there questions? Already. What? So physiological buffer systems. The respiratory system regulation of acid-base balance is a physiological buffering system. There is a reversible equilibrium between the amount of dissolved carbon dioxide and water and carbonic acid and the hydrogen ions and bicarbonate ions. So this is our equation. During carbon dioxide unloading, when we're getting rid of carbon dioxide, hydrogen ions are incorporated into water. When hypercapnia or rising plasma hydrogen ion levels occurs, meaning that hypercapnia meaning increased carbon dioxide levels, which is going to increase the amount of free hydrogen ions. Deeper and more rapid breathing will work to expel more carbon dioxide, and the hydrogen ion concentration is reduced. Alkalosis, meaning we're more basic than we should be, causes slower, more shallow breathing, causing hydrogen ions levels to increase. The respiratory system impairment will cause acid-base balance, resulting in either respiratory acidosis or respiratory alkalosis. Either you have too much carbon dioxide or you don't have enough of it. If you have too much of it, you're acidotic. If you don't have enough of it, you're alkalotic. Chemical buffers can tie up excess acids or bases, but they can't eliminate them. The lungs eliminate carbonic acid by eliminating carbon dioxide levels. Only the kidneys can actually get rid of metabolic acids. So the ultimate, your lungs can keep trying to work on making you less acidic. But if you're going to get rid of anything metabolic that keeps being produced, acids, the only way for you to get rid of them is through the kidneys.
Is that why my dog, when her kidneys were going, she was coughing a lot?
Probably.
Yeah. Oh.
I didn't know that that was the case, but that would make sense.
Yeah, she died of kidney failure.
Ouch.
I mean, well, I euthanized her before it became inhumane to keep her alive, you know.
I can understand that. I've heard it's really awful.
Yeah, the vet told me like it would be the kindest thing to do would be to euthanize her.
Ouch.
Oh, it was hard. Anyway, but she was coughing a lot. So I'm wondering if like that's like a function of the kidneys not working.
Mom, would that be a function of the kidneys not working? If a dog is in kidney failure, would they cough a lot? Would you get a buildup of carbon dioxide? Okay. She says no.
Oh, okay. Well, maybe there was other stuff going on that I was unaware of.
Claire, just a sec. She's in another room. Say it again, Mom. Okay, because of the kidneys failing, there's a buildup of fluid. And the buildup of fluid can result in a buildup of fluid in the lungs, causing the coughing.
That makes sense. Too.
I would think that if they were trying to get rid of CO2 with regards to kidney failure, they would start, the breathing rate would go up. Does that make sense? Or
Yes.
drop down significantly if they're basic.
Yes.
So most important renal mechanism for regulating this acid-base balance. So really when the lungs can keep trying to compensate for the kidneys. But when it comes right down to it, the kidneys are the ones that are the real players in regulating pH long-term. The most important renal mechanisms for regulating acid-base balance are the conserving or generating of new bicarbonate ions. Either you reabsorb more or you generate new ones, or you get rid of them. If you're too acidic, you're going to reabsorb or generate them. If you're too basic, you're going to excrete them. And losing a bicarbonate is the same as gaining a hydrogen ion. Reabsorbing a bicarbonate is the same as losing a hydrogen ion. Let me, I had a student this semester at Stevenson. So here's our equation again. Here's our equation right here. And she put it this way, and I thought it was actually pretty good. Bases mop up by hydrogen ions. They just get rid of them, clear them out. And so if you add another bicarbonate to the body, you get rid of a hydrogen ion because it mops it up. If you get rid of a hydrogen ion, you increase the amount of bicarbonate by 1. So if you want to, so gaining a hydrogen ion is the same as losing a bicarbonate. Gaining a bicarbonate is the same as losing a hydrogen ion. Does this make sense?
Yes.
Okay. So think of it that way. We're gonna, if we want to be more basic, we'll increase the amount of bicarbonate because it will get rid of the hydrogen ions. If we want to become more acidic, we'll get rid of the bicarbonate because it will get rid of the hydrogen ions. Or if we get rid of the bicarbonate, we'll increase the amount of hydrogen ions. So let me come back to this place. Losing a bicarbonate is the same as gaining a hydrogen ion because there's no longer something around to mop up whatever free hydrogen ion you want to keep around. Reabsorbing a bicarbonate is the same as losing a hydrogen ion because it will mop it up. Also, hydrogen ion secretion is going to occur in the proximal convoluted tubule. and in the type A intercalated cells of the collecting duct and distal convoluted tubule. Hydrogen ions come from the dissociation of bicarbonate, carbonic acid. Carbon dioxide, if we're going to reabsorb bicarbonate, so we're too acidic, we've got too many free hydrogen ions around, so we're going to reabsorb bicarbonate. Carbon dioxide combines with water, forming carbonic acid. Carbonic acid then immediately dissociates, breaks down, forming hydrogen ions and bicarbonate ions. For each hydrogen ion that gets secreted, so for each hydrogen ion that gets removed and leaves in the urine, a sodium ion and a bicarbonate are reabsorbed. So in addition, as you lose every hydrogen ion, remember, if you lose a hydrogen ion, you gain a bicarbonate. In addition to gaining a bicarbonate, you gain a sodium ion. Thus, the secreted hydrogen ions will form carbonic acid. That immediately dissociates into hydrogen ions and bicarbonate, and the bicarbonate disappears from the filtrate at the same time that it enters the peritubular capillary blood. Actually, so secreted ions, you reabsorb a bicarbonate and you secrete a hydrogen ion. So the bicarbonate is going to disappear at the same rate that it enters the peritubular capillary blood. Guys, is this clear? So looking at this reaction, I'm going to zoom in a little bit here. This is the filtrate, meaning this is what's ultimately going to become the urine. If it stays in the tubules, it's going to become urine. If it comes in the blood, if it gets reabsorbed and moves this direction, it's going to get taken up by the blood. So carbon dioxide, very easily diffusible, diffuses into the lumen of the kidneys. It interacts with water to form carbonic acid. Carbonic acid then immediately dissociates to form bicarbonate and hydrogen ions. The bicarbonate, gets reabsorbed either with sodium or via the chloride shift. And the hydrogen ions diffuse into the lumen, combine with bicarbonate to form carbonic acid, that then again immediately disassociates to form water and carbon dioxide. Carbon dioxide then diffuses into the tubule cells, where it interacts with water to form carbonic acid. Carbonic acid then immediately disassociates to form hydrogen ions and bicarbonate. Bicarbonate gets reabsorbed either with sodium into the plasma blood or it moves into the blood via the chloride shift. The hydrogen ions diffuse into the lumen of the tubules, interact with bicarbonate to form carbonic acid. And the carbonic acid then will dissociate again. So in this way, we are reabsorbing bicarbonate, making the blood more basic. Is this clear?
Yes.
So carbon dioxide then diffuses into the tubules, where it acts to trigger more hydrogen ion secretion, because it's just going to keep happening over and over again. Hydrogen ions have to be excreted to form new bicarbonate. They have to be excreted to form new bicarbonate. If you're going to reabsorb bicarbonate, you have to excrete hydrogen ions. You guys, if you hear that, my landlord, who I think we've talked about it. The guy who lived above us passed away, and our landlord is making major renovations and repairs to the apartment above us. That's what that noise is.
I can't hear anything. I can't hear.
Okay, good. Okay, good. But if you do hear it, that's what's going on. So dietary hydrogen ions, you've got to counteract them by generating new bicarbonate. The excreted hydrogen ions are going to bind to buffers in the urine, specifically the phosphate buffer system. Intercalated cells actively secrete hydrogen ions into the urine, right here. Bicarbonate is generated through moving it into the interstitial space via a co-transport system, or passively moving it into the peritubular capillary blood. So when we don't want to just keep generating hydrogen ions or reabsorbing bicarbonates, don't want to keep just reabsorbing bicarbonate. We are going to tie up the hydrogen ions in the filtrates with phosphate. So carbon dioxide plus water forms bicarbonate. Remember that carbon dioxide can come in from the filtrate, it can come in from the plasma, just diffuses wherever it wants to go. Forms carbonic acid. Carbonic acid immediately breaks down into hydrogen ions and bicarbonate. Bicarbonate moves into the plasma via the chloride shift. And the hydrogen ions diffuse into the blood and get mopped up with the phosphate base to form phosphoric acid and gets excreted. So for each hydrogen ion that the kidneys generate, they're going to excrete an equal amount or secrete an equal amount of hydrogen ions. Is this clear?
Yes.
So you guys, this is just, these diagrams right here are things I got from other classes that I teach and other schools that I teach, these figures. This is a figure from your book describing the same thing. Describing the same thing. It's describing the same thing. I don't know which is better. That's why I'm including them both. So hydrogen ions in the blood interact with carbon dioxide to form carbonic acid. Carbonic acid then decomposes, immediately breaks down into water and carbon dioxide. Carbon dioxide gets taken up by the cells, interacts with water to form carbonic acid, which then immediately breaks down again into bicarbonate and hydrogen ions. The bicarbonate gets reabsorbed into the plasma. The hydrogen ions can diffuse into the filtrate within the kidneys with the reabsorption of a sodium ion. Remember how for every hydrogen ion you secrete, you reabsorb one bicarbonate and one sodium ion. So sodium bicarbonate is found in the filtrate. The sodium gets reabsorbed with the secretion of a hydrogen ion, which binds with the bicarbonate in the filtrate, forming carbon dioxide. Excuse me, carbonic acid. Carbonic acid then breaks down into water and carbon dioxide. Carbon dioxide can get taken up again into the tubules, interact with water, form carbonic acid. Is this clear?
Yes.
Yes.
So when the renal tubules secrete hydrogen ions into the peritubular fluid, they do what at the same time?
Do they reabsorb sodium?
Oh yeah, yes, they do. Good job. Yes. So they reabsorb sodium because that's what we're seeing here. If you secrete a hydrogen ion, you reabsorb a sodium. One other way that we can help kidneys can work to reduce the acid levels is to excrete ammonium. One more time, what was the functional property of an amino group? What was what was the chemical functional characteristic that we cared about before?
That the amino group is basic and the carboxylic is acid.
Right.
Got it.
So if we excrete ammonium ions, what are we doing?
Increasing the acidic level of it.
Are we increasing the acidity by excreting them?
You're lowering it.
I'm lowering it. I'm making it more basic. Does that make sense?
Perfect sense, actually.
Okay, well, good. Okay, I got something that makes perfect sense.
It's a lot, but it makes sense.
Okay, I understand that it's a lot, and I'm glad that we're readdressing. I'm glad we're addressing it. This method. So another way that we can bring down the acidity of the body is to use ammonium ions produced by the metabolism of glutamine. Glutamine is one of the amino acids. It's got the amino group here, carboxylic acid here. It also has an amino group right here. One of its, remember how all amino acids have carboxylic acid and an amino group, and then they have an R group. This is the R group of glutamine. So this method uses ammonium ions produced by the metabolism of glutamine. So you break it down. Each glutamine, when it's broken down, produces 2 ammonium ions and 2 bicarbonate right here and right here. The bicarbonate gets reabsorbed into the blood, and the ammonium ions absorb hydrogen ions and get excreted. The amino groups absorb hydrogen ions and get excreted.
I have a question.
So
So I know we're like talking about like how it works, but to accomplish, let's say if somebody was, respiratory alkalosis or acidosis, like how do you accomplish that with, like you were saying, the amino group being basic and the carboxyl group being acidic, but if somebody in real life has those issues, how do you buffer it in a real, like, I know they give you, okay, what I'm trying to say is a person that has, if they're like, respiratory acidosis, for example, they will give them, or alkalosis, they will give them paper bag, to inhale all the carbon dioxide and hydrogen back that they were breathing out because
breathing it in to make yourself more acidic.
Exactly. So if this amino will, having the more amino will cause the body to be basic, to accomplish that, what are they giving you? Does that mean like they will give you more protein to take? Or I'm just trying to apply what you're saying to real life. And
let me ask my mom. Mom? Yes. I know you want, can you come here for a second? She's really dressed. She actually got up right before class. Okay, so ask your question one more time, Miss Sina.
Sure. So I was saying,
listen to what she's saying.
For a person like that's respiratory alkalosis or acidosis, they would like, try to fix that issue by for example, like a person that has respiratory alkalosis, they will give them the paperback, right? So that they can take back the hydrogen that they inhaled out, the carbon dioxide back to their body. So if the amino group is basic and the carboxyl group being acidic, do they give them like protein to buffer the body if the person has high carboxyl group in their body?
She's never dealt with that.
Dealing with
Okay.
proteins and balancing acid base.
With balancing it.
So, yeah, but you can see, carbon dioxide.
Can you speak a little louder, Mom?
Oh, carbon dioxide is going to make it more acidic. So if you're really base because you've been hyperventilating, then you're breathing in carbon dioxide. It's going to bring you back into balance. But as far as dealing with managing acid-base balance with amino acids, that's not in my realm.
And I honestly, I'm not sure you would even try to use them as a supplement. Does that make sense?
Yeah.
Because it's going to compound the problem on both ways. Possibly. Does that make sense?
Okay. Yeah, I was just trying to apply as we were going this, like, how does it work in my head? So
Yeah. What did you say, Mom? So the body's trying to correct itself. And so if you overcorrect, then you're in trouble. This is the way the body is trying to correct itself. Does that help?
yeah. So I guess basically they don't take like, supplements on the side to fix it. The body, just like you say, fixes it itself, I guess, with all this.
The body's going to keep trying to correct itself. You can do the CO2, breathing in and out of a bag, but your kidneys really ultimately have to, you have to fix kidney function, and then the kidneys will do it themselves.
Sure.
Does that work? Does that
Yeah.
make sense?
Thank you.
Yeah, so basically breathing through the bag
Yeah.
is a temporary fix, I would think.
Right. Right. So long term, the kidneys are really the only ones who can fix the problem.
Got it.
That was a really good question, and I wish I had a better answer for you.
Thanks, Zena.
Yeah, good job. So amino ion excretion. So you get 2 amino groups and 2 acidic groups. The amino groups get excreted, the bicarbonate gets reabsorbed. So you eliminate the hydrogen ions at the same time that you absorb the bicarbonate. Because the hydrogen ions get mopped up with the amino basic groups. Sorry, just a sec. So, oh, that was nasty. So amino acids get metabolized. They give up to the glutamine gets metabolized. It gives up 2 ammonium ions and 2 bicarbonate. Bicarbonate binds up with the hydrogen ions and immediately becomes carbonic acid that then will break down again into bicarbonate. the hydrogen ions get given up to the filtrate with the reabsorption of a sodium. Hydrogen ions, excuse me, bicarbonate can also break down into, carbonic acid can also break down into bicarbonate and hydrogen ions. Hydrogens get secreted as sodium gets reabsorbed. And the hydrogen ions displace the sodium to form phosphoric acid that it gets excreted in the urine. Is this clear?
Yes.
So when the body is in alkalosis, type B intercalated cells are going to, remember we have these intercalated cells are in the distal convoluted tubules and the collecting ducts. This is a figure that I got from online last night. Apical, remember apical meaning this is going to be where the lumen is going to be. This is going to be where the plasma is going to be. Actually, bear with me. Yeah, that's right. Okay, so this is going to be where the lumen's going to be, meaning the filtrate. This is going to be where the plasma is going to be. So when the body is in alkalosis, type B intercalated cells are going to show bicarbonate secretion and get rid of bicarbonate by introducing it into the filtrate that will then get excreted as urine and work to reabsorb hydrogen ions and acidify the blood. The mechanism is the opposite of type A intercalated cells. Type A intercalated cells are going to work to reabsorb bicarbonate and excrete hydrogen ions. So they're working in opposition. One is going to work to reabsorb, to secrete, excrete, or secrete bicarbonate. One of them is going to work to secrete and excrete hydrogen ions. So even during alkalosis, the nephrons are going to excrete fewer bicarbonate ions than they conserve. Questions? Results from failure of the respiratory system to balance pH results in respiratory acidosis or alkalosis. Because we know that the kidneys only affect the carbon dioxide levels, the partial pressure of carbon dioxide is the single most important indicator of respiratory inadequacy. When the carbon dioxide levels are normal, they're going to fluctuate between 35 and 45 millimeters of mercury. When the values are above 45 millimeters of mercury, this indicates respiratory acidosis. When the values are below 35 millimeters of mercury, this is respiratory alkalosis. Respiratory acidosis is the most common cause of acid-base imbalance. It occurs when someone breathes too shallowly, meaning their carbon dioxide levels are just accumulating, or gas exchange is hampered by diseases such as pneumonia, cystic fibrosis, or emphysema, meaning carbon dioxide levels are accumulating. Respiratory alkalosis is a common result of hyperventilation. So you're just breathing off too much CO2 and you become basic. All pH imbalances, except those caused by abnormal blood CO2 levels, are metabolic acidosis. When a metabolic acid-base imbalance is when the bicarbonate levels are above or below 22 to 26 milliequivalents per liter. So if they're 27 milliequivalents per liter, you're an acid-base imbalance and you're metabolic alkalotic. If your bicarbonate levels are 19 milliequivalents per liter, you're in metabolic acidosis. So metabolic acidosis is the second most common cause of acid-base imbalance. Typical causes are ingestion of too much alcohol or excessive loss of bicarbonate. Other reasons, other causes may include accumulation of lactic acid, shock, ketoacidosis or ketosis in a diabetic crisis, starvation or kidney failure. Rising blood pH levels and bicarbonate levels indicate metabolic alkalosis. So if your bicarbonate levels are really high. Typical causes are vomiting of the stomach, acid contents of the stomach. So if you're going through a period or you have the stomach flu where you're constantly vomiting, what's the acidity of your stomach like?
High.
It's really high. So if you're constantly vomiting, what's happening to the amount of free hydrogen ions in your body?
Are they being depleted?
They're being depleted, right? And you're becoming very alkalotic. Another reason is that you've taken in too many antacids, which are bases. Or constipation in which excessive bicarbonate has been reabsorbed. So respiratory, some causes of acidosis and alkalosis for respiratory and metabolic. Renal, so compensations. Acid-base imbalance is going to be compensated for by another system. The respiratory system will attempt to correct metabolic acid-base imbalances. The kidneys will work to correct imbalances caused by respiratory disease. So the respiratory system will attempt to correct it. The kidneys will attempt to correct it. And metabolic acidosis, the rate and depth of breathing is going to be elevated to try to get rid of the CO2 levels. The blood pH will be below 7.35, and the bicarbonate levels are going to be low. And as carbon dioxide is eliminated via this increased rate and depth of breathing, the partial pressure of carbon dioxide is going to fall below normal. And respiratory acidosis, the respiratory rate is often depressed and is the immediate cause of the acidosis. In metabolic alkalosis, compensation will be exhibited by slow and shallow breathing, allowing carbon dioxide to accumulate. And correction will be revealed by an increased pH and elevated bicarbonate levels and a rising partial pressure of carbon dioxide. To correct respiratory acid-base imbalance, renal mechanisms are stepped up. Acidosis is going to have high partial pressures of carbon dioxide and high bicarbonate levels. The high carbon dioxide levels is going to be what causes it, and the high bicarbonate is going to indicate the kidneys are retaining bicarbonate to offset it. So someone who is acidotic is going to have a high partial pressure of carbon dioxide and have high bicarbonate levels in order for their body, because their body is trying to correct for the high carbon dioxide levels. Alkalosis is going to have a low partial pressure of carbon dioxide and a high pH, because the kidneys will eliminate bicarbonates to stop the reabsorption of hydrogen ions to try to bring up the amount of hydrogen ions in the body. This right here as just an overview of relationships between fluid, electrolyte, and acid-base imbalances. So, true or false? The blood plasma osmolarity is higher than the intracellular fluid osmolarity.
I want to say true.
You would think, but it's not. The osmolarity tries to stay equal throughout.
So false.
It's false. Yep. It's false. Fluid intake is governed by hypothalamic receptors called osmoreceptors.
True.
True. The kidneys secrete antidiuretic hormone in response to dehydration.
True. No.
They respond to it, but do they secrete it?
No, the posterior, what is it? Pituitary does, right?
Right.
The hypothesis. Right. What is that called? The hypothesis?
What?
Isn't that area of the brain called something? It has like a name. I don't
Oh,
know.
hypo.
Oh, I probably said it.
Adenohypophysis.
Yes, that one.
You were said hypothesis, which is an educated guess.
I was like, oh, a what?
I meant.
Which was what you were doing, an educated guess. Good job.
That was really funny. All right. Hypovolemia refers to a reduction in the total body water while maintaining a normal osmolarity.
True.
It's true. Aldosterone promotes potassium excretion.
I would say true.
It is true. Because aldosterone is going to promote sodium absorption by promoting potassium excretion. They're working in opposition of sodium and potassium. Chloride homeostasis is regulated as a side effect of sodium homeostasis.
False. Don't they work together?
They work together.
Yeah.
And so, and chloride follows sodium. If it can. If at all possible, it does. So the answer is actually true. Because chloride is the balancing ion of sodium. The three physiological buffer systems are the urinary, digestive, and respiratory systems.
False.
False. What are they?
Isn't it psychological, chemical, and drawing a blank on the last one, but it's psychological. Is it mechanical?
Nope. And you were right about it being false. So let me tell you what the answers are.
Okay.
Bicarbonate,
Oh.
phosphate, and protein.
Yep.
It's all right. I thought psychological, really.
There's one. I was doing a educated guess. I knew the answer was false, but
It's all an issue with, it's all in your head. If you would figure out what was going on in your head, you'd be fine.
that's
Like this. Can I talk to the doctor?
Um,
Here's my.
I need to remember that
And
one.
my drug test.
So last one here.
John, will you please?
Last one here. Acidosis is a pH lower than 7, whereas alkalosis is a pH higher than 7.
True.
What?
True.
It's not.
It's not.
What's the pH of the body?
isn't it like 7.4?
1.35 to 7.45, right?
It's between 7.35 and 7.45.
Mhm.
So what this means is that acidosis is a pH lower than 7.35. And alkalosis is a pH higher than 7.45.
Oh, okay, that makes sense. I was thinking lower than 7, anything.
I know, and that's why it's a good question. That's why it's a good question. All right, you guys, let's take a couple minutes break here and come back and work on the digestive system. We'll
All right.
quickly go over the respiratory system in lab and then continue with the digestive system.
Sounds good. Thank you.
Okay, see you in a second. So ask, what were the kind of physiological systems? And the question was true or false, urinary digestive, something else. I said, what are the real ones? And she says, psychological. And I try to, I let them finish their answer. I try to throw it out the holes. But I said, yes, I said, I have to. I said, you just have to, remember it's all in your head. I'm glad I have such a relationship with you guys. So I can get it. And then have that kind of relationship with us. Like, each other partners with us. The parents picking on my face in class, and it's so well, well, I was picking on her dry face. Yes. That hurts. mean, I understand, it may have been completely thoughtless, and I don't want to know what some professors have thought about some of my consequences. But I felt so bad for that student. Her dad's mom has given, being the care provider of her dad, and then her grandpa is in the hospital, and she's down to over to do this, and she's asked for doctors. And I just asked her yesterday what the hospital is, what's happening. And I think it's some, she met with Carol Schmidhauser. Carol Schmidhauser told her to talk with someone else in March or something like that. I don't know who it is. Yeah, I don't know. Well, but I didn't have a lot of time. This was our house, and I was trying to keep it relatively quiet. What I did want to know that, yeah, maybe she was going to survive because that made me feel that. I told my students yesterday, they were complaining about their lab for this day. And they said, the other labs say that they do a lot of tastings. And I said, and they hate them. They don't, they're not telling you that right now, but they hate them. And they said, well, we haven't done any of them. I said, why don't you put that in for evaluations? And I went on and I told them, I said, you can put in there, you can say that you love the lab and you thought the lecture sucked. I said, but do me a favor, when you say that, say what? I said, you can also put in there that you love lab and you hated, you love lecture, you hated lab. I said, you're not gonna have my debate where I said, but put it in there. I said, I am at the very bottom, and the one student, she said something about how much she's been frustrated with lab because of the lack of hands-on activities. And I said, well, and I said to her, you need to put that in there. I said, because I can't change it. And I don't know if I should have said that, but I said it. Yeah. Well, I said, I am the newest adjunct for this year. I said, and I am therefore on the very bottom of the total. I said, this is something that if you think it bothers you, you need to take it out. You need to say something. And I said, I know that I'm not the only one who needs those evaluations. I said, at least at another school that I worked with, I got a letter from the dean saying that they were my evaluations. And they looked at me and I said, thankfully they were all positive evaluations. And they laughed. But they said it was something, that told me that I wasn't the only one reading evaluations. So we'll see what happens. But the ones they were frustrated because their final for physiology is all case studies. And they haven't had any, and not in their lab. My students have had more than they ever wanted of case studies. And I guess, I don't know how many they've actually got. Because I don't, usually they're not very happy right now. Period. So here is their side of the story. But I said, you go and look them over and then let's talk about them. I looked over the case studies. They have the case studies. They have the notebook. I said, look them over and let's talk about them again. And I realized, oh, I'll tell you later. All right. Becky, I am glad that I have the kind of relationship with you that when I laugh at the fact that you called it a psychological buffer, you don't take it too personally because I thought it was really funny. She's not even there. All right.
I'm here.
Okay. Let's jump into digestive system. This will probably be a little easier to comprehend, hopefully.
I heard you, and I think
Okay,
it's
good.
hilarious because I do nothing but laugh at myself. So I appreciate somebody laughing with me.
Did you hear me tell my mother about it?
I did miss that part.
Okay, I said it kind of quietly, but I was telling her about it. Yep, it's just all in your head.
But isn't there is the reason I said that is because I feel like I remember learning something that there is like a psychological or a mechanical, is it a chemical something reaction?
Yes, there's a chemical reaction.
Okay, that would
Physiological.
There you go.
Okay.
Psychological, physiological, it all goes hand in hand.
Same thing. Same thing.
That's why I said that, because I was like, I knew I remembered it from something, but that's funny. But no, I think it's hilarious. And you know me well enough at this point that I pretty much just laugh at myself and appreciate anybody laughing with me. So we're good.
Good. Okay. So digestive systems. I think this is going to be easier. Hopefully, there's a few more details, but it's easier overall. Digestive system functions. Ingestion. So introducing foods into the stomach. Introducing foods into the body. Mastication, chewing, and the mixing of food. Propulsion, moving food from one area to another. This includes deglutition, meaning swallowing, moving the bolus, meaning the partially chewed up food that comes out of your mouth, that goes down into your esophagus. Peristalsis, waves of muscular contraction, and mass movement, moving foods in the large intestines. Mixing, moving food back and forth, and thereby mixing it with digestive enzymes. Secretion, lubricating, secretion includes lubrication, liquefying, and buffering of food. So secretion, you secrete mucus, which lubricates the food and the lining of the digestive tract and protects against mechanical abrasion, stomach acid, and digestive enzymes. Water, you secrete water, which will liquefy the food and make the food easier to digest and absorb. And bile, which will emulsify the fat. You also secrete enzymes, which performs chemical digestion, breaking down the food into smaller molecules or particles. Digestion, you have mechanical and chemical digestion. Proteins are broken down into amino acids. Carbohydrates are broken down into monosaccharides, meaning simple sugars. One single subunits of carbohydrates. Lipids are broken down into fatty acids and glycerol. Absorption, movement from the GI tract into circulation in the lymph. So things are being moved from the GI tract into the circulation in the lymph. Using diffusion, facilitated diffusion, active transport, usually predominantly secondary active transport, and symport or endocytosis. And then elimination, waste products are being removed from the body. So the main organs involved in the digestive system are the mouth, the pharynx, the esophagus, the stomach, the small intestines, and the large intestines. The accessory organs are the salivary glands, the liver, and the pancreas. Which of the following is not an accessory organ of digestion?
Is it B?
B is in Bravo,
Yeah.
not an accessory organ. No. What else could it be?
E.
See, say it again.
E.
Let's look up again one more time. Oh, you know what? E is under accessory organs. That's not included on this list, but it would be included on the list. What else could it be? I'm sorry, I missed the spleen. I didn't list that one. What other one?
Salivary gland? Well, no.
Oh,
Because
no,
Is
look,
So
which,
A.
yeah, which of the following is not an accessory? It's A. All of the other ones, and I need to remember, I'll add that during our break, that I need to put spleen under here too. So the layers, the GI tract, gastrointestinal tract from the esophagus to the rectum is one tube composed of 4 concentric tunics. The mucosa is the most inner layer. It's lined with stratified squamous epithelium, and then a lamina propria layer, and muscularis mucosae. The submucosa contains esophageal glands in the esophagus. The muscularis externa has 2 muscular layers. It has an inner circular muscular layer, meaning forming rings along the tube, and an outer longitudinal layer, meaning a linear muscle layer. And that serosa is the most outer layer. The myenteric plexus of the enteric nervous system is in between the serosa and the muscularis externa. The submucosal plexus is just deep to the submucosa. So myenteric plexus in between the muscularis externa and the serosa. The submucosal plexus within the submucosa. Both of these are part of the enteric nervous system. And remember that the enteric nervous system is like a subdivision or a subcategory of the autonomic nervous system. It's not technically part of the autonomic nervous system, but at the same time, it regulates itself as a nervous system in a lot of ways, with some feedback from the autonomic nervous system and the central nervous system. So the mucosa abuts most inner layer abuts the lumen of the GI tract, is a mucosal membrane lined with simple columnar epithelium. It's not simple columnar, stratified squamous. Areolar connective tissue and smooth muscle. Actually, you know what? It's got both. It's got both stratified squamous and simple columnar. I will fix that later, but it's got both. It has stratified squamous because we need that. We need that lining right here. But it's also got simple columnar because it's involved in absorption. It secretes enzymes, mucus, and hormones. And major functions are absorption through the simple columnar epithelium and protection through the stratified squamous epithelium. It depends on what part of the mucosa you're looking at. The submucosa is made of dense connective tissue and contains blood vessels, lymph nodules, and nerve fibers, part that are contained part of the submucosal plexus. The muscularis, which has the myenteric plexus, is composed of muscle tissue. It's skeletal muscle from the mouth and the upper part of the esophagus, and then smooth muscle from the lower esophagus into the large intestines. So the mouth through the upper esophagus is voluntarily regulated through that skeletal muscle. This from the lower esophagus into the large intestines is the enteric nervous system, involuntary. The serosa or adventitia or visceral peritoneum. Remember, visceral peritoneum meaning the peritoneum right up against the organs in the peritoneal cavity. Covers all organs and is made up of connective tissue covered with simple squamous and secretes mucus that prevents friction. So it's deemed as a serosa or the adventitia. But when it's in the peritoneal cavity, you can call it the serosa, but you also need to recognize that it's also called the visceral peritoneum because it's in the peritoneal cavity. And we'll talk more about that in a second. The layer that is responsible for the motility that propels food and residue through the digestive tract is called what? What do you think it is?
B.
B is in Bravo?
Yes.
Yes, because it's muscle, right? Muscularis externa. It's what's going to propel things forward.
And it was a question on the whatever homework I did yesterday.
The quiz or the smart book or somewhere in there.
Somewhere in there, yeah.
All right, that's awesome. Okay. Each of the following lists some of the tissue layer. Excuse me, each of the following lists some of the tissue layers of the digestive tract. Which one has them in the correct order from the lumen, the most inner layer, to the external surface?
A.
Yes. Does that look right to everyone else? So lamina propria, muscularis mucosae, submucosa, muscularis externa, serosa. So oral cavity and the pharynx, got teeth, got the uvula, the tonsils, the oral pharynx. The lips, the gums, the tongue. Deciduous teeth, meaning baby teeth. You have 16 of them. Oh, no, not 16, 18 of them. Looking right here, count them, Mary. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, 20 of them. I'm sorry, I should learn to count and then I'd remember. 20 deciduous baby teeth. 20 on the top, 20 on the bottom. Permanent teeth, 32. So infants, as I just learned to count, infants have how many deciduous teeth, whereas adults have how many permanent teeth? One, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then they have 10 on the top.
A.
A. So of the teeth, the incisors, you have 4 per jaw, and their main function is in biting. Being able to cleave things. Canines or cuspids, you have 2 per jaw, and their main function is tearing. Being able to tear things apart. Premolars or bicuspids, 4 per jaw, and their main function is crushing and grinding. molars, tricuspids. You have 6 per jaw. And their function is crushing and grinding. Your mouth usually, evolutionary wise, your mouth is getting smaller. And so typically your jawline, the size of the human jaw, Homo sapien jaw, only has space for 2 molars. So the third one on both the top and the bottom are those darn wisdom teeth that most of us have to have removed. Because they just don't fit in our smaller mouths. Looking at the tooth structure, we have the crown and we have the clinical crown, which is the section of the tooth above the gum line, and the anatomical crown, which is the entire enamel covered part of the crown down into here. The neck is the enamel part of the tooth that's below the gum line. The root is below the neck and crown, the rest of the tooth. The pulp cavity is filled with blood vessels, nerves, and connective tissue. The enamel functions in protection, and it's made of calcium phosphate and carbonate, and it's the hardest substance in the body. Probably the most resilient, most enduring substance of your body. They've taken the enamel from how old was it? 1.8 million year old rhinoceros species. Taken the protein sequences and from that derived the DNA sequences and been able, with that information, been able to figure out who the relatives and the descendants of that 1.8 billion year old animal was. And the way they did that was by getting some of the enamel of the tooth of the fossil, because it's so resilient and sticks around for so long. The dentin is the calcified connective tissue. The cementum is what is actually going to form, is going to be bone-like material that anchors the teeth in the jaw. And then the periodontal ligament that holds the tooth in the socket that forms the gomphosis. The cementum and the periodontal ligament are going to form the gomphosis joint. Salivary glands, parotid gland and ducts. So the parotid gland, right anterior to the ear, is going to secrete salivary amylase. What does amylase break down?
Starches or carbohydrates.
Starches and carbohydrates, right? The submandibular meaning underneath the mandible, submandibular gland is going to secrete salivary amylase and mucus. The sublingual gland, meaning right underneath the tongue, is going to secrete mucus. This is the one that gives dentists the most amount of grief, and this is why you get tartar on your bottom incisors. Is because the ducts for it are right next to your incisors. Questions? The esophagus is a long muscular tube that's approximately 10 inches long. It's lined with stratified squamous epithelium. And it pierces the diaphragm at the hiatus. There's a hole in the diaphragm where the esophagus passes through the diaphragm. And it's actually called the esophageal hiatus. Esophageal hiatus. There's two major sphincters, an upper esophageal sphincter and a lower esophageal sphincter. The lower esophageal sphincter is located below the diaphragm, opens during swallowing. It's right here, opens during swallowing, and allows food to enter the stomach. The esophagus has no digestive or absorptive functions. But you can be really glad that it's lined with stratified squamous epithelium when you choke on a Dorito. So initiation of swallowing, deglutition. The bolus is partially chewed food mixed with saliva, so mixed with salivary amylase and mucus. Swallowing is a marvel of the somatic and autonomic nervous system, and that it's amazing how well it works and how well coordinated it is. Swallowing will trigger receptors that simultaneously are going to close off the trachea by the epiglottis, close the nasal passages, and temporarily halt breathing. I remember, so I think I've probably mentioned this, maybe I have, maybe I haven't. Before I moved to the East Coast, I worked with rescue humane societies. And I worked with a lot of baby kittens and baby puppies, mainly baby kittens. I worked with baby puppies through my mom, but mainly kittens. Preemies, a lot of time, especially baby puppy preemies, don't have a gag reflex, which is part of the reason they're more inclined to die, is because they don't they don't have the ability to cough it up once it goes into their lungs. And what that means, thinking about this right here, what that has to mean is that they just have not developed to that point to where they can have that that automatic autonomic reflex. So swallowing follows 3 phases. There's the voluntary buccal phase, where the bolus of food is moved by the tongue from the oral cavity into the pharynx. The pharyngeal reflex, which is controlled by the medulla oblongata and the pons, where the soft palate will elevate and the upper esophageal sphincter relaxes, elevating the pharynx that opens up the esophagus. The food is pushed into the esophagus, the bolus is pushed into the esophagus via the peristaltic pharyngeal constrictor successive contractions that are going to start at the top and move towards the bottom, progressively moving things downward, the bolus downward towards the stomach. The epiglottis is tipped posteriorly due to the pressure of the bolus. And the larynx is elevated in order to prevent the food from passing into the larynx. And the esophageal reflex will stretch the esophagus to initiate peristalsis of the muscles in the esophagus. You can see why this is kind of a marvel. Somehow this all happens the second food gets moved from the oral cavity towards your pharynx. So the voluntary phase, the tongue pushes the bolus posterior toward the oral pharynx. The bolus in the pharyngeal phase, the bolus enters the oral pharynx, and the soft palate and the epiglottis, soft palate, seals off the nasopharynx, and the epiglottis seals off the nasopharynx and larynx. Excuse me, soft palate seals off the nasopharynx. So that doesn't make sense. The soft palate seals off the nasopharynx. The larynx, the epiglottis seals off the larynx. In the esophageal phase, peristaltic waves are going to move the bolus down the stomach, down the esophagus towards the stomach. So the swallowing center is located in the what? Where do you think the swallowing center would be found? Swallowing center meaning the control center.
In the brain, like not muscularly, but like for the voluntary
Where
reflex?
in the brain?
The medulla oblongata.
Medulla oblongata. Acid reflux into the esophagus or heartburn is normally prevented by what? What do you think would prevent it? The upper esophagus is the upper esophageal sphincter is around here. The lower esophageal sphincter is down here. Where do you think it's prevent? Acid reflux into the esophagus is normally prevented by what?
The lower C.
Yeah, the lower C, the lower esophageal sphincter. Splenic circulation. So what actually drains and supplies the digestive organs? The arterial supply of blood to the digestive organs consists of branches from the abdominal aorta, including the celiac trunk, the superior mesenteric artery, the inferior mesenteric artery, and their branches. Digestive organs are drained by veins that drain into the hepatic portal vein that delivers blood to the liver for processing. The blood that drains from the liver occurs via a set of hepatic veins, which then drain that blood into the inferior vena cava. So all of the blood that drains from the digestive organs is going to drain into the hepatic portal vein, which is going to drain into the liver. And then the liver blood gets drained by the hepatic veins. And the inferior vena cava then receives that blood from the hepatic veins. So any blood that's coming from the digestive organs is going to get processed within the liver before it gets into the heart. Organs of the digestive system are supplied with nerves that mainly come from the autonomic and enteric nervous system. Sensory receptors are found in the walls of the organs. The receptors respond to stimuli such as stretch, fluid concentration, meaning osmolarity, pH, or certain products within digestion. When the receptors are stimulated, their axons come in contact with neurons in the autonomic nervous system and enteric nervous system that initiate the appropriate response. Neurons of the somatic nervous system, peripheral nervous system, enteric, and even central nervous system are also involved in many of these digestive reflexes. And these plexuses of nerves are going to work together to control the secretion from and motility of the GI tract. So the blank regulates the digestive tract motility, secretion, and blood flow. And its neurons are found in the what? What's the major nervous system that's involved in digestive tract motility?
I want to say A.
You're close, but it's not A.
Central?
Nope. What's the major one over the digestive system?
Oh, enteric?
Enteric. And so the only answer here has to be C. And remember that the submucosa and the muscularis externa, the myenteric plexus is in the submucosa. The muscular plexus, I don't think that's right. Muscularis plexus is in the muscularis externa. I know that isn't right. It doesn't sound right coming out of my mouth. So I'm sorry, bear with me just for a second. I knew it up until a second ago. Submucosal plexa. Myenteric plexa, I thought that doesn't sound right. Submucosal plexa, I apologize. Submucosal plexa is in the submucosa. The myenteric plexa, because my meaning muscle, the myenteric is in the muscularis externa. Questions so far? The abdominal pelvic cavity houses the peritoneum. The peritoneum is the largest serous membrane in the body. The pancreas, duodenum, rectum, kidneys, and ureters are retroperitoneal, meaning they're behind the peritoneum. So if we're looking at this cross section right here, or now I can't, okay. We're looking at this cross section right here. This is the peritoneum. This is the peritoneal lining. Anything that's behind this lining is retroperitoneal. So the duodenum is retroperitoneal. Pancreas is retroperitoneal. This is a mid-sagittal section, so it's going right through the midline. That's why we don't see the kidneys here. We also don't see the spleen, which is also back here. So anything that's behind this line is retroperitoneal because that's what retroperitoneal means, behind the peritoneum. The other organs are completely within the peritoneum and are therefore intraperitoneal. The visceral peritoneum, or serosa, when we're talking about the peritoneum, covers the organs. So the serosa around the organs in the peritoneum is synonymous with visceral peritoneum. The parietal peritoneum lines the walls of the body cavity. And part of the parietal peritoneum includes the greater omentum, which is a fatty apron that covers the intestines, and a lesser omentum, which connects the liver and the stomach. And then the peritoneal cavity is filled with serous fluid. So when the greater omentum, initially when you dissect the cadaver, you run into this major greater omentum fatty apron that you have to remove. When it's retracted, you can see the mesentery that contains the vessels and the nerves of the large and small intestines, connecting things together. And the mesocolon. The lesser omentum, connecting the stomach and the liver. So serous membranes that suspend the stomach and intestines from the abdominal wall are called what? I'm gonna look right here. Serous membranes that connect the stomach and the intestines to the abdominal wall are what?
Mesenteries.
Mesenteries. Peritonitis, the one I'm most familiar with when it comes to peritonitis, because I told you I worked in rescues, was feline infectious peritonitis, which is horrible. You spread from a mother cat to her babies, and almost always for babies it's lethal. There's no cure for it right now. But inflammation of the peritoneum leads to peritonitis, where the blood or the contents of the abdominal organs leaks into the peritoneal cavity, usually caused by trauma that ruptures a blood vessel or an abdominal organ, and often involves a bacterial infection. Most patients experience rebound tenderness, which means that little pain is felt when a hand is placed on the abdomen. However, there's significant pain when the hand is removed. Results from inflamed membranes that snap back into place when the hand leaves the abdomen. And treatment for peritonitis can involve antibiotic therapy and surgery to correct the underlying cause. The stomach is a temporary storage for food and performs mechanical and chemical digestion. It's going to secrete mucus, acid, and pepsin. There's 4 basic parts. The cardial part, think of the cardial part as being the part right next to the heart. That's the way I remember it. Cardial part. The fundus, the body, and the pylorus. The pylorus contains a ring of smooth muscle, the pyloric sphincter, that moves gastric contents into the small intestines. There are 3 types of muscle here, 3 layers of muscle here. The longitudinal muscle. So rather than normally, if you remember in the rest of the GI tract, we have 2 basic muscle layers, right? We have the circular muscle and the longitudinal muscle. In the stomach, we also have an oblique muscle layer, where rather than having the fibers run longitudinally or circularly, we have them running obliquely. So what that also says is that there's a lot of mixing going on in the stomach. Because why else would you have an additional muscle layer? So 4 basic tunics, the serosa or the visceral peritoneum, because we are in the peritoneal cavity now. The muscularis, which contains an outer longitudinal muscle layer, a middle circular layer, and an inner oblique layer. The submucosa and the mucosa, which will form rugae when the stomach is empty. Stay with me for just 3 more minutes here. First, any questions? Within the stomach, we have gastric glands. Gastric pits are the openings into these glands that secrete gastric juice and are composed and have some, also contain goblet cells which secrete mucus. Different cells of the gastric glands are the mucous neck cells, the parietal cells, the chief cells, and the diffuse neuroendocrine cells, or Dines cells, or G cells. So mucous neck cells, parietal cells, chief cells, or diffuse neuroendocrine system cells. Mucous neck right towards the top that secrete mucus. Chief cells, Dines cells, and parietal cells. Parietal cells are going to secrete the intrinsic factor, which works to bind vitamin B12 and helps with this vitamin's absorption. B12 is necessary for production of mature red blood cells. Mucous neck cells are going to, you guys, this is a great place to quit for right now. So we will come back to right here. We will finish this. I think let's finish this and then we'll talk about the reproductive system. We will finish this.
Sounds good.
Yep. So plan on it, and I will see you in an hour and 20 minutes.
See you then. Thank you.
Welcome.
Thank you.
Welcome.
Is there any way you can check to see if the virtual lab nervous system lab exercise 1617 was recorded? Was it done? Like, I have been trying it forever. I feel like
Bear
to
with
do
me.
it, it won't let me.
Yeah, give me a second. Let me look.
Okay.